Quality in the clinical microbiology lab. Quality assurance in the laboratory involves several critical components to ensure accurate and reliable results. Quality assurance of specimens focus on proper collection, labeling, transport, and storage to maintain specimen integrity. Quality assurance of media and reagents ensures that all culture media, stains, and chemicals meet specified standards for performance and sterility with regular checks for expiration and contamination. Quality assurance of equipment and instrumentation involves routine calibration, maintenance, and performance verification of all laboratory instruments to guarantee consistent functionality. Finally, quality assurance of methods and procedures includes validation and standardization of laboratory techniques, adherence to protocols, and regular staff training and competency assessments to maintain high quality testing standards.
All right, QA or quality assurance. So in our quality assurance program, there are different steps that we need to follow and kind of analyze. Those would be pre-analytical, analytical, and post-analytical. So the pre-analytical is going to include the ordering of processing of tests, collection, transporting of the specimens, and then the initial processing of the specimen. So in microbiology, that would be plating the specimen on to a plate, an agar plate. Analytical is when you are actually reading your plate and doing the workup off of that culture, as well as the interpretation of the results. So the identification of the organism, reporting of the susceptibility testing, those types of things. Post-analytical is going to include the written report, the types of communication to the clinician, how the clinician will interpret the report, and also initiation of appropriate therapy. So when we look specifically at specimens, the quality of collection is critical. So the quality of the results is going to be based on the quality of the specimen. You get a bad specimen, you're going to probably get a bad result, which is why it's important to understand the requirements and what is actually needed so we are putting out the results that are good for our patients and physicians to be able to treat them. Oftentimes with micro, the specimens that we receive are collected by personnel not within the laboratory. So a lot of times it does require some staff education and training to make sure that the specimens submitted for microcultures are appropriate. So we need to make sure the volume and site preparation are there, and it does not influence the outcome. Instructions should include how to prepare the culture site, how to avoid contamination, what type of volume is required, and what that minimum volume is. Make sure that the labeling is appropriate on the specimen. Make sure that the requisition is also filled out the way it needs to be. Um, and then making sure the specimen is packaged and delivered as well, as far as where it needs to be stored, that type of stuff. And then also understanding the criteria for rejecting a specimen if needed. Generally, it's the lab that provides the appropriate swabs and containers to the testing or the collection personnel. We do need to make sure that we pay particular attention to the swabs. They could be cotton, they could be Dacron, they could be a different type of material. So we just kind of need to make sure that it's the appropriate one. Depending on whether you're swabbing for bacteriological studies or virology, the material of the swab will impact the recovery of the organism. You need to have part of your standard operating procedure to specifically include what type of swab it is and if it's aerobic or if it's an anaerobic culture. As far as the requisition is concerned, it needs to include your typical stuff like your patient name, medical record number, date and time of collection, physician name, test to be performed, and any other pertinent patient information that would help us in the lab that we would need to know to perform the testing. Acceptable specimens. So unacceptable specimens include unlabeled, mislabeled, or incomplete label if it's not fully filled out the way it needs to be, if the quantity is not sufficient or QNS, if there's improper transport media, or if there's been an inappropriate handling. It hasn't been handled the way it needs to as far as time, temp, storage, things like that. So for example, if you get a culture from a vaginal site and it's for Neisseria gonorrhea, don't put that in the refrigerator. That's kind of a picky organism and it's going to kill it if it gets put in the refrigerator versus just sitting out on the counter for a little bit. Proper collection site for test requests, especially when we get an anaerobe culture. There are multiple sites where anaerobes are normal flora. So that won't really tell us anything if we recover those in that culture. So there are actually a lot of improper sites that we won't even accept the sample from if it's for an anaerobic culture. Another unacceptable specimen is if the specimen has leaked. So you will see this if you haven't already in the lab. Make sure you are rejecting those, especially if it's for micro. And if it is a serum specimen, we need to look at it and see, is it hemolyzed? Is it lipemic? Is it contaminated with bacteria such as normal flora from the venipuncture?
Quality control involves using standardized strains of organisms, such as those provided by the American Type Culture Collection, ATCC, to test reagents and media, ensuring consistent performance. Detailed records of all quality control procedures for every test performed must be maintained, reviewed regularly by the lab supervisor, and retained for documentation and auditing purposes. This systematic quality control process helps maintain accuracy, reliability, and reproducibility in laboratory testing.
Quality assurance of equipment and instrumentation. You will also run maintenance and preventative maintenance checks on your equipment. So the frequency of what those are is going to be dictated by your manufacturer, and there's really no room for deviation. If they tell you it has to be daily, make sure you're doing it. Keep surfaces clean, generally with 10% bleach. Make sure, like we mentioned earlier, that you're doing your maintenance as needed. If it's daily, weekly, monthly, biannually, annually, whatever it is, make sure you're doing it. And then also make sure you're documenting that you're doing it. We like to say in the lab, if you didn't document, you didn't do it. So make sure you document everything, really. Preventative maintenance, or PM. The PM check needs to include in the instrument name, serial number, date of implementation in the lab. And again, the procedure and like how often you need to do the function checks at a minimum is going to be what the manufacturer requires. Function checks must be within the acceptable limits prior to any patient results being reported. So just like in hematology, chemistry, things like that, you need to make sure that your quality control is working. And if it's not, then no patient should be reported out during that time frame until it is. With instrument failures with specific details need to be documented, as well as any corrective action that you took to try to fix the problem. And if that instrument failure needs to be resolved before any patients are performed once again.
Acceptable performance ranges for all instruments must be clearly established and adhered to. All service requests, including the date and time of the request as well as the response, should be thoroughly documented. Maintenance of these records must follow the frequency and procedures specified by the instrument manufacturer. Additionally, all records should be retained for at least the lifespan of the instrument to ensure traceability and compliance with quality assurance standards.
Quality assurance of methods and procedures. So basically for everything we do in the lab, we have a standard operating procedure or an SOP manual that is required. This is to be used by all employees, and it's also a good resource for new employees or when you're training a new employee as well. It's kind of the golden book, if you want to say. It has everything in there that you need to know. Um, CAP, or the College of American Pathologists, heavily emphasizes the procedure manuals and the use of these. And these are formally updated annually. The documentation of this is going to be signed or reviewed by your lab director. And if you implement any new procedures or you revise an existing procedure, then that review needs to happen and occur at that time along with the signature as well. Proficiency testing. So like with all other areas of the clinical lab, microbiology is also going to participate in proficiency testing. There's a requirement for external proficiency testing for each organism or test that we do. And you have to maintain at least an average score of 80% to maintain your accreditation. So if you dip below that, they can come in and say you're not allowed to perform this test anymore. Proficiency testing specimens should be handled exactly as a patient would be, so no repeating unless it's needed to verify an abnormal result. And that's really only if you would do that for a patient. If you wouldn't normally do it for a patient, then you're not going to do it for your proficiency testing. You're also not going to set it up in duplicate or anything like that. Some facilities can also do internal proficiency testing, and really this should be the same person should not be doing the testing for proficiency testing. So a lot of times labs will create a calendar of sorts that shows who's going to be doing it each time it comes in. So if you have 4 people in the lab that can perform a certain test, then you'll have, it usually comes, 3 to 4 times a year. So if you happen to be that person, you'll do it once that year. They don't want the same person doing it over and over. They want to make sure and ensure that everybody in the lab who performs it can actually perform it, and they prove so by doing proficiency testing.